You're listening to Civic from the San Francisco Public Press. We'll learn about an outreach effort working to make COVID vaccines more available to people with barriers to access by bringing doses right out to the streets.
When we send those teams out over 2.5 to 3 hours, reliably, we could find between 10 and 20 people who accepted the vaccine. And considering that each person needs to be observed for 15 minutes, that's a pretty good number of vaccines. Those numbers did not diminish. There are still a lot of people out there who would willingly accept the vaccine were it made easy for them.
I'm Laura Wennis, and this is Civic. The majority of San Francisco residents have gotten vaccinated against the coronavirus. With more than 80% of residents having gotten at least one jab, we have a very high level of vaccination here. But it's not everyone, and public health officials are still emphasizing how important it is to get vaccinated for those who haven't yet. But some people, especially marginalized people, don't trust the healthcare system. Their encounters with it have been distinguished by disrespect, dismissal, and generally negative experiences. Dr. Margot Kushel has been part of an effort to make getting the jab easy and a good choice for people who don't have access or don't trust the system. She's a physician and a researcher at UCSF, where she also directs the UCSF Benioff Homelessness and Housing Initiative. They've partnered with groups like Code Tenderloin to send roving groups of healthcare and outreach workers into the streets with vaccines. I also went to the Tenderloin to walk along with one of those groups. The team I went with administered more than 20 vaccines right there on the street in a few hours. That's coming up soon on Civic, but for now, here's Dr. Kushel. So you and a few other colleagues wrote earlier this year that successfully vaccinating the more than 1.5 million people who stay in shelters and encampments each year requires 4 elements: establishing people's eligibility to get the vaccine, ensuring equitable access for disproportionately impacted communities, adopting a tailored approach to reaching them, and committing to being trustworthy. I'm hoping we could go through these in a bit more detail, but let's start with equitable access, since it seems to me like eligibility has been established. And we're now past the days in San Francisco when demand for, the vaccine far outpaced the supply. Does that necessarily mean that access is now equitable, though?
No, I think when we think of equity, we think of it as different than equality. Yes. Equality means everyone gets the same thing. Equity is really much more about everybody getting what they need. And if you're a person experiencing homelessness who faces so many barriers, you have competing demands. You need to spend all of your time thinking about where you're going to sleep, where you're going to get food, are you going to be safe? You have huge barriers to things like transportation. You're much less likely to have a primary care clinician. You're less likely to have access to the internet. Equity really demands that we roll out vaccines in a different way. And what I would argue is what would be equitable for people facing homelessness is that we bring the vaccines right there to where people are. We offer them in a way that is trustworthy, and that we offer repeated access, meaning the rest of us have time to read the internet, to talk to our physicians, to make informed decisions about what we know as healthcare providers to be 100%, very safe, very effective intervention, but it took more time to bring the public there. Mm-hmm. And taking more time for populations experiencing homelessness means not making it a one-time offer, but coming back again and again, being sure their questions are answered, and being sure that we're ready to give the vaccine right when they're ready to get it. It also means providing support for people to manage what are anticipated and fully safe, but can be difficult side effects of the vaccine, right, which we know are part of it. We know people's arms get sore, people can even run a fever. These are all things as healthcare providers, not only do we accept, but we celebrate as signs that the vaccine is doing its job. For people getting it, those can be both scary and uncomfortable, and so we want to be able to manage those.
Yeah, I was pretty miserable after my second shot. I cannot imagine having to do that while sleeping in a tent. How do you manage that for folks? Is that
exactly? What we have been offering, and our group has been focusing with incredible collaborators in the Tenderloin District, is bringing vaccines right to where people are. We have teams going out with Code Tenderloin, who are an absolutely brilliant and incredible group of people who live in the Tenderloin, many of whom have expertise as being homeless themselves in the past or experience with similar situations, who know the community well. They guide us, they lead us, we follow them, but we provide healthcare providers, vaccines, and go right to where people are. So we have little backpacks and rolly carts, and we walk up to people standing on the street. We walk into SRO buildings. We walk into treatment programs. We walk into stores or restaurants, street corners, encampments. We bring the vaccine to them. When we're there, we talk to them about what they can anticipate about side effects, and we've been really lucky to have been donated by a group called Bay Area Life Sciences, or Life Sciences Cares, has donated basically sort of gift bags, but the gift bags are targeted to the vaccines. They have clean socks, because everyone who's homeless can use clean socks, but they also have things like small packets of Tylenol, ibuprofen, some electrolyte drinks, other things that people might need to make the experience a little more comfortable.
Yes, that makes a lot of sense. In mid-June, I think Supervisor Matt Haney tagged along with Code Tenderloin on one of those outreach trips, offering the vaccines then and there. Yeah. I'm just wondering how big a part of your overall outreach strategy this boots on the ground approach makes up. Are there other strategies in place too that we should be thinking about?
Yeah, there are plenty of other strategies throughout the city to address the needs of populations experiencing homelessness, or those in permanent supportive housing, those in shelter-in-place hotels, and those are in SRO hotels as well. This is a multi-pronged strategy that includes bringing vaccines into shelters. It includes having what they call like Ask a Doc, or having a healthcare provider available to answer questions. We, BHHI, Benioff Homelessness and Housing Initiative, worked with Code Tenderloin, with Glide Clinic. We worked with San Francisco Community Health Center, and we worked with UCSF Health, and we, BHHI, recruited large numbers of volunteer clinicians. We worked with our collaborators to have pop-up tents, so that we had every Thursday in front of Glide, we were available. About 6 or 7 weeks ago, we started working Saturdays in Bodecker Park. Code Tenderloin, Glide, SFCHC outreach workers, we're going around, we're letting people know we would be there, we're advertising, answering questions. So we offer the chance for people to drop into a low barrier setting. It was much less intimidating than, let's say, a mass vac site, and it was right there in the community. Mm-hmm. That certainly helped, and we got many people, and in ways there was efficiencies of scale, right, to be at a place rather than going around to people, which takes more time. Mm-hmm. But we realized after the first few weeks when we started setting these up in late March that the numbers coming to the sites were decreasing. And at that point, we really turned our efforts, we flipped our efforts, so we sent more people on foot going out. Mm-hmm. There have been other groups working with the Department of Public Health to offer vaccines in all the shelters. There have been teams systematically going into single-room occupancy hotel. We at the BHHI were helping to arrange that strategy, to chart numbers, to figure out where people are. And there are similar efforts going throughout the city. But it really comes down to the principles of making this as low barrier as possible, not making people need to make an appointment first, to being right there in the communities where people are, but to even go beyond that. Being in the communities, low barrier, no appointment needed, trusted community members was a huge part of it. But at the end of the day, we realized that we really need to bring the vaccine to exactly where people are.
Yeah, it seems like having a tailored approach to reaching people and being trustworthy are really closely interlinked. I mean, does the way that you approach someone also make a big difference in how trustworthy you are to them?
Absolutely. I think, first of all, the fact that we go to people rather than demanding that they come in is a way to build trust. Yep. But I can't emphasize enough how much our efforts were led by Code Tenderloin. Who really in the Tenderloin is seen as a very trusted entity. They know the community, they've been there, they get it. And so they really took the lead. They would, we had multiple meetings a week with them, and they would surface questions. They would say, somebody I ran into asked me this. And if they didn't know the answer, they didn't make it up. They asked the healthcare providers. We shared it with them, and they were able to bring that message back to the community. on vaccine days, which again, we did about 2 days a week. Other groups were doing other days. We were involved in launching another effort at Larkin, which we didn't run, but we helped launch, and they were also doing street outreach. In each of these places, being trustworthy to me meant going in with trusted community members who are playing the lead role, being sure that people had access to the most up-to-date, accurate information. It meant doing anticipatory guidance. We know that after the vaccines, as healthcare providers, we celebrate the fact in a way that people's arms are sore or that they feel under the weather for a day or two. Because to us, that shows that their immune system is working, that their body is mounting an effective response. That isn't a problem, but for someone who experiences it, it can be quite disconcerting. So we didn't sugarcoat that. We let people know that we anticipated that, explained what that meant, and then provided them the support to get through that time.
Mm-hmm. One of the lowering of barriers that I imagine might be in place is it seems that there would be a distinct advantage to a one-dose vaccine for people who are being reached sort of impromptu on the street because of the potential difficulties of having to schedule a follow-up appointment. Are you mainly using or are you promoting the J&J one-dose vaccine?
We realize that there are, pluses and minuses. In some communities, there is fear of the Johnson & Johnson vaccine, and there's no question that there are extraordinarily rare but true side effects that are seen in those vaccines and not in the others. Extraordinarily rare. No question in my mind that the benefit outweighs the risk. But again, we wouldn't want to lie and say that there wasn't this special warning, for instance, for reproductive age women about this very, very rare but possible side effect of a form of blood clots. And so we, as part of our principles, always carried two choices. We carried one dose Johnson & Johnson one-dose vaccine, as well as one of the two mRNA vaccines. Those are the two-dose regimens. People know them as the Pfizer vaccine and the Moderna vaccine. Mm-hmm. And we gave people a choice. What we found was that when people came to our site, I would say 50-50 chose the Janssen versus the mRNA. When we went out to people and gave them the choice, they almost all chose the Janssen. In some ways, the people whose lives were in such a way that they could make it a few blocks to our site, those were the same people who some of them said, I've heard better things about the two-dose one. I'm going to go with that. And we had outstanding rates of follow-up. But for many, many people, when we explained the risks, the benefits, the trade-offs, I would say that of people who we went out and gave it to them on the street and encampment, et cetera, 95 or more % chose the one-dose regimen.
Wow. Okay. Well, those results kind of speaks for themselves.
Yeah, exactly. And so, it wasn't up to us to say, some people think that the two-dose is, slightly better. We really armed people with information and trusted them to make the decision that was right for them. We think that all of these vaccines are extremely powerful and effective.
Mm-hmm. I'm hoping to find out more from people being reached out to themselves soon, but just from your perspective, how are your patients and the people that you work with and are doing outreach to feeling about getting vaccinated in general? Are there concerns?
I think in many communities there's concern, but in San Francisco we've done remarkably well with a very high overall rate of vaccination. I think, what I would say for people experiencing homelessness is perhaps there's a slightly lower level of what we would call vaccine confidence than in the general population. There is more distrust of the government. There have been more traumatic experiences with the healthcare system. Thus, people need a little more work to trust. So maybe the rates of low trust or low confidence in vaccines is higher than in the general community. That said, I think that access trumps distrust. I think we're all very quick to say, everyone who didn't get vaccinated is an anti-vaxxer, when much more often it was just that the barriers that people experienced. And so when we went out to people, each time we sent a team out, and this is resource-intensive work, but each time, up through this weekend, when we send a team out, which has a code tenderloin person, one or two vaccinators, and one or two people accompanying them to enter all the information we need, because we want to keep track of these things so that people know that they've been vaccinated. When we send those teams out over 2.5 to 3 hours, reliably, we could find between 10 and 20 people who accepted the vaccine. And considering that each person needs to be observed for 15 minutes, that's a pretty good number of vaccines. Those numbers did not diminish. There are still a lot of people out there who would willingly accept the vaccine were it made easy for them. What I found when I've been out and what my teams have found when they've been out is that the vast majority of people who say no because they've already gotten it. People either generally say yes, or they say, you got me last week, you got me 2 weeks ago, and therefore I don't need it. So, I would say the same thing. I don't need it again. I've had it already.
Right.
A really maybe a guesstimate is that of the people who say no, a third of them say no because they don't want it, compared to 2/3 of those who say no because they've already gotten it. That's just sort of a back of the envelope calculation that there are certainly people who say no. But I think that is really way less than the people who either say yes or who said, you did it last week, I don't need it. Thank you. You already got me.
I'm speaking with Dr. Margot Kushel, a physician and researcher at UCSF and director of the UCSF Benioff Homelessness and Housing Initiative. So more than 80% of the city's overall population over age 12 has now gotten at least one dose. Do you have any sense of what portion of the city's homeless population has been vaccinated?
We're trying to figure that out. That those numbers are surprisingly hard to get a handle on. We know who's in the shelter system, but we know less of the exact numbers of people who are currently unsheltered. I would estimate that it is substantially below 80%, but it's, I think it's as long as these efforts continue, as long as they're spread throughout the whole city, and as long as they're repeated, I think we'll get there. One thing I really want to emphasize is someone saying no once does not in any way mean that they're not going to say yes the next week or 2 weeks later. So we just need to keep asking and offering and making this extremely accessible. I love it that there are outreach teams going throughout the city trying to convert people from no to yes. I would argue that what those outreach teams really need to be is that coupled with someone standing right there with a vaccine. Because what we find time and time again is if we can say, we mean now. If you say yes, we can do it right now and get it over with. People overwhelmingly say yes. And we just need to keep working and expanding those efforts. 80% is tremendous. But San Francisco isn't a closed system. We're going to start getting more and more tourists. The Delta variant is extremely infectious. We really want to not say 80% and we're done. We want to keep going and really make sure that everybody has every opportunity to have this life-saving vaccination.
So if I'm understanding what you're saying correctly here, it's, the proportion of people who have been vaccinated who are experiencing homelessness is likely lower than the proportion of housed San Franciscans, but that seems to be more due to not making it easy for folks to get vaccinated rather than due to some kind of, stigma against the vaccine. Is that right?
There is clearly distrust. There are clearly people who don't want to get it. I guess what I'm saying is the numbers of people who haven't gotten it because access is a problem, outweighs the number of people who aren't getting it. Because I think that we lean into this narrative of people don't want it, and it sort of gives us an out to not offer and keep offering. One thing, having now spent many, many weeks walking the streets of San Francisco with vaccines or being at the base camp and sending teams out, is how important it is to have people watch people that they know and like get vaccinated. How many people are sort of say no, and someone in the group will say, heck, I'll do it. And then their friends they will become our best outreach workers, our best advocates, and their friends will say, okay, he did it, I'll do it too.
Yeah.
And so I guess I don't want to say that there isn't mistrust. There are good reasons for this community to not trust us, right? I don't want to say that there's no mistrust or no lack of confidence. But what I do want to say is I think that is trumped by the number of people who just haven't had the opportunity. I was amazed. I mean, one day I was out and we went into a store where there were two people, a father and a son, working super hard, serving customers in their store. And they were super excited when we said we could vaccinate them right then and there. And we vaccinated them like while they were ringing up customers, and they were cheering, they were taking selfies. They just had been working 12 hours a day and just hadn't had the chance to go and get vaccinated.
Wow.
It would be very, very easy to look at them and say, oh, they don't trust this, when in fact it was just an issue of access. Again and again and again, as I said, like, we're not hitting a wall. Like, I know reliably if I send one of those mini teams out, and most Thursdays we sent 4 teams out for 2 different shifts, and Saturdays we sent 4 teams out for 1 shift, the shifts being 2.5 to 3 hours. Each of those teams could get between 10 and 20 more people vaccinated.
Wow.
We're not running out of people by a long shot.
Interesting. We keep talking about trust, and that is the 4th element that you highlighted in the 4-element structure. Part of the piece that you co-wrote notes that this means providing higher quality and dignified medical care all around. So how do you make yourself as a healthcare entity trustworthy, which seems to be the most important part here, rather than giving people information about the vaccine specifically?
Absolutely. I think it's important to recognize that not all communities have felt like their healthcare providers were trustworthy. And it's really easy to say, oh yeah, Tuskegee, which obviously was a crime against humanity and just awful. But I think it's much harder for us to recognize that every day, in ways big and small, healthcare systems can, with all good intentions, be not deserving of trust, be untrustworthy. We don't always keep our word because we're busy, because we're overwhelmed. We judge people. We have stigma against people who use drugs or people who are homeless. We have we have racist practices, and we are, this is racism is sort of the soup that America swims in, and healthcare systems and individuals within those systems are not immune from that. We don't have nearly enough racially and ethnically concordant healthcare providers to match the communities that we serve. All of these things lead to a lack of trust. And so I think we need to just go out of our way. And the burden is really not on the patients to trust us more. The burden is on us as providers, as systems, as clinicians, to be as trustworthy as possible, to give our word and to be good to that word, to examine our own internalized racism, the stigma we might hold against people who use drugs, or people living in poverty, or people with criminal justice backgrounds, and really interrogate that and treat everybody with in ways that build trust.
What about the issue of respect? How do you establish that you respect someone in of the medical establishment or of a healthcare provider, and you will treat somebody with dignity when they've been burned many times before, and this might be your first interaction with them because you're doing street outreach?
Right. And I think when we're doing this first interaction, first of all, having somebody from the community who we really defer to plays a big role. Right, that in some ways we are taking advantage of the enormous trust that outreach workers have built with communities, and so that helps a lot. I think answering in a way, listening to people's questions and taking them seriously, treating those questions as coming from an honest place of really wanting to know an answer, not being dismissive of people's fears or concerns. Those fears or concerns come from a place. It's very tempting because as healthcare providers, we know that these vaccines are absolutely incredibly effective at preventing a terrifying and dangerous disease. It can be really tempting to try to sort of bully people into taking them, but I think ultimately that does us a disservice, and that we're better off listening, really hearing what people are saying, really hearing their concerns, taking those concerns at their word, and trying to provide evidence-based information without feeling like we are, our job is to sort of bully people into taking these.
Yeah. Yeah, with that in mind, what are your top priorities now in terms of getting people who are experiencing homelessness vaccinated? What are the, areas where you really need to push hard right now?
Yeah, I mean, I've been really concerned, as have many, with the Delta variant. In some ways, I worry that as we have opened up, we have left our communities and ourselves vulnerable. And, the virus has mutated, and the Delta variant seems to be particularly infectious. We are once again, it's sort of horrifying, but we're seeing outbreaks. There was an outbreak in a shelter in Sonoma. There have been some outbreaks in Alameda shelters. There are starting to be outbreaks in shelters again. Mm-hmm. And I think that we need to, first of all, to continue our best practices using non-pharmacologic interventions, making sure ventilation is good, making sure the shelters are as uncrowded as possible, and making sure people are wearing masks. I mean, that seems like basic principles. And I think we need to offer again and again and again the vaccine and explain why we believe in this vaccine so much. I think that it's important that we don't, on these communities, we keep offering the vaccine. I had been a very big proponent of giving an incentive with the vaccine. We heard from people living in shelters that would make a big difference to them. Getting a $10 or $20 gift card would really push them and make them comfortable with the vaccine. I think there has been some hesitancy on that, particularly at the beginning, some concerns that would be coercive. Mm-hmm. But then I laughed, of course, because we had these big statewide lotteries and things like that. In my mind, it would have been a much better practice, instead of grossly rewarding, just hugely rewarding one person, but to actually offer people a $20 incentive, $10 incentive that would help them in some ways make up for that lousy day that they might feel under the weather with the vaccine. I think that was a little bit of a missed opportunity. I think it came from a good place of concerns that people didn't want to be coercive, but that's at least what people told us when we talked to them in December and January. So I wish that had been done. I think there might still be time to do it, although now you run into the possibility of creating some bad feelings among the people who didn't get that. But I think we need to just keep offering. We need to really take people's concerns seriously, but we need to keep providing the best information possible. And we need to do whatever we can to keep people safe, to make sure that the shelters aren't too crowded, to keep ventilation good, and to really lean into mask wearing while we try to improve vaccination rates. Mm-hmm.
Well, certainly something to keep an eye out for what's going on there. Thank you so much for taking the time to talk with me about this. I learned so much.
Of course. Wonderful talking to you.
That was Dr. Margot Kushel, a physician and researcher, and director of the UCSF Benioff Homelessness and Housing Initiative. And keep an ear out, because coming soon, we'll take you along on one of those outreach efforts. I'm Laura Wennis, and you've been listening to Civic. Before I let you go today, at the Public Press, which is Civic's parent organization, we've been working really hard during this pandemic to pursue angles we're not seeing much coverage of elsewhere, or to take a more systemic look at the issues that are surfacing in the headlines. The San Francisco Public Press is a nonprofit, and we're inspired by the public radio model. That's the idea that people who are able to support the work that we do so everyone can have access to it without paywalls or ads. If you think we're onto something, we'd very much appreciate if you could show your support. You can do that by going to sfpublicpress.org/donate, or by helping us get the word out about this show. Subscribe on whichever podcast platform you use, or leave us a review. It really does help, so thank you.